Hello, welcome to our first online class this finals. Our topic is about back and spine region. Now we're done with your extremities and now let's proceed to the axial skeleton. So let's talk about your anatomy, which is your vertebral column. Normally, you have a total of 33 bones, but as we grow up, it will reduce down to 26 because your sacrum and your coccyx will fuse into one. And you have a total of 23 ivy discs. So the breakdown of your vertebra is your cervical region, which there are a total of 7 bones, thoracic vertebrae, a total of 12 bones, lumbar region, a total of 5 bones, sacral bone, a total of 5 bones fused into one, coccyx, 4 bones fused into one. So there are 2 normal curvature, which can be seen on the lateral side. So the two curvatures are your primary curve, or also known as kyphosis. Kyphosis can be seen on thoracic region and sacral region. And primary curve, remember guys, that present at birth. Secondary curve is also known as lordosis. It is present on cervical region and lumbar region. Cervical region starts from 2 to 3 months, when the baby starts to control their neck, while the lumbar spine starts from 10 to 12 months, when the baby starts to sit. So the normal mobile segment, or the functional unit of a vertebrae, is composed of 2 adjacent vertebrae and 1 ivy disc. So what are the parts of a typical vertebra? So the 2 parts are divided to anterior and posterior. Anteriorly, you have your vertebral body. Your vertebral body, its main function is for weight bearing. And the posterior part are your neural arch, and it's composed of pedicles and the posterior elements. Pedicles. Pedicles transmit forces from the posterior elements to the vertebral body, and it also connects the posterior elements to the vertebral body. Another function is it forms the roof of your intervertebral foramen, where your spinal nerves exits. Next is your lamina. Lamina is located here. Lamina, its function is to transmit forces or tension from the posterior elements to the pedicle to the vertebral body. And also, in your lamina, there is a region there that is commonly injured if you have improper posture, and for common among elderly, which is your pars interarticularis. Pars inter pars interarticularis. Next is your spinous processes and your transverse processes. Well, its function is sites for muscle attachment. Then lastly, your articular processes. Your articular processes forms your facet joint, or also known as zygapophyseal joint. So here's a picture again of your typical vertebra. Next is your ivy disc. Your ivy disc separates two vertebral bodies, and its main function is to increase available motion. This picture here is the anterior view of your spine. So your ivy disc has three parts. You have your nucleus pulposus. Your nucleus pulposus is a gelatinous mass found in the center, and it is composed of 70 to 90% water and a 65% proteoglycans. Proteoglycans are proteins that attracts water. Next part is your annulus fibrosus. Your annulus fibrosus is located outside your nucleus pulposus and is composed of 60 to 70% water and 20% proteoglycans. Remember that your nucleus pulposus has a type 2 collagen, which resists compression, while your annulus fibrosus has type 1 collagen, which resists tension. And lastly, you have your vertebral end plate, which covers your ivy disc. It is located superiorly and inferiorly. So here's again another picture of your ivy disc anterior view. So this picture here, so this is the picture of your ivy disc top view. Now, let's talk about the 6 main ligaments of the spine. So, first you have your ALL, or also known as anterior longitudinal ligament. Remember that your ALL connects the anterior vertebral body, and it is the only ligament that limits extension. And by trivia, your ALL is the strongest ligament of the spine. It starts from your C2 down to your sacrum, and its continuation superiorly from your C2 to your occiput. That is your anterior atlanto-occipital ligament and your anterior atlanto-axial ligament. Next ligament is your PLL, or also known as your posterior longitudinal ligament. It connects the posterior part of the vertebral body. and it limits flexion. It starts from your C2 down to your sacrum, and its continuation superiorly from C2 to the occiput, that is your tectorial membrane. Next ligament is your ligamentum flavum. Your ligamentum flavum connects all the laminas. It starts from your C2 down to your sacrum. So it's the top view of your ligamentum flavum, side view of your ligamentum flavum. Its continuation superiorly from your C2 to your occiput is your posterior atlanto-occipital ligament and your posterior atlanto-axial ligament. And also, it limits flexion. Next is your interspinous ligament. It connects adjacent spinous processes. It starts from your cervical vertebra down to your lumbar vertebra. It limits flexion. Next is your supraspinous ligament. Your supraspinous ligament connects all spinous processes. It starts from your C7 down to your L3 or L4. Its continuation superiorly from your C7 up to your occiput, that is your ligamentum nuchae. And then lastly, you have your intertransverse ligament, in which it connects adjacent transverse processes. Well, we have no picture, so basically it is located here. It limits extension and contralateral lateral flexion. So that ends our part 1.